Today, in this topic, I am going to discuss with you about the continuous glucose monitoring, which has become very popular in last 4 to 5 years. And let's see how can this help you in managing your diabetes. So many times when people come to me, when I ask them that, do you check your sugar at home? So they request me, Doc, can I please skip sugar checking by picking myself, as it gives me pain and stress. So this is my reaction. So tell me, how many of you monitor your blood sugar levels at home? Please raise your hand. Wow, good number. I'm impressed. Good job. What gets measured gets improved. Peter Drucker, economist, he said long back, for the business. But I can tell you that we can use this philosophy when you are checking diabetes, because if you measure it, it gives you feedback, it gives us feedback, and you know where are you going. If you don't check it, most of the time you are in illusion that everything is fine, I'm not feeling anything. So we'll start with history of glucose monitoring, the journey of more than 100 years, the different type of glucose monitoring system which are prevalent, what is the future of CGM, and we'll end with some important take-home messages. So in 1908, Benedict developed the urine glucose testing. As you know, the diabetes were derived from siphoning through, it was actually through urine. So urine glucose testing. After that, in 1965, first glucose strip was devised. In 1970s, the glucometers, they came, and by 2000, they became very popular. They became very popular, and people started using them at home. But the real breakthrough came in 2016, when the first continuous glucose monitor for the patients was launched, which was Freestyle Libre. And then came Dexcom G6, and these two have changed the scenario of diabetes management. So you can see here that we started with the urine testing more than 100 years back, and then now we have so many different types of sensors which are going to help you in controlling your sugar. So what is a continuous glucose monitoring system? The continuous glucose monitoring system means monitoring or tracking your sugar or glucose levels continuously or multiple times by using a variable technology without pricking your finger. It measures sugar or glucose in interstitial tissue. Remember, it doesn't measure your sugar exactly in the blood. It measures in interstitial tissue. And it has 3 parts. So people who are using, they are very well aware of it. It will be easy for them. So just to make it simplified, this is the CGM sensor which is under your skin when we fix it. And this is the transmitter which you see as like a coin. And your mobile is the receiver. So from here, the glucose is measured, it goes here, and you can see on your mobile device. So why do we need CGM or continuous glucose monitoring? Because for many people, the checking by pricking is demanding and painful. So they prefer not to do it. Then in some people like type 1 diabetes, type 2 diabetes, on insulin, or pregnant women who need to monitor their sugar 4 to 6 times, that is really, really demanding and painful. So, and then to understand the impact of different food items, so many people when they use glucose sensor, they realize that what they were eating was not good. And they were able to control their portion size, and they were able to change the type of food to see that their readings are under control. The most important indication to use CGM is to detect low and high sugars timely or early to take the necessary action. As you know, the low sugar or hypoglycemia can be detrimental to the person who is having diabetes. And then we use them as a part of insulin pump. Now HbA1c is the benchmark or yardstick to measure your sugar control, as all of you are aware of it. And it tells you the glucose control of last 2 to 3 months. but it doesn't show you the fluctuations on day-to-day basis. This is known as glycemic variability, or variability of the sugar on day-to-day basis. And that has a significant impact on your overall well-being and on your heart. So we need some tool to see what is happening on day-to-day basis so that we can tune ourselves to achieve the desired control. Now, what are the common indications for using CGM? So people with type 1 diabetes, because they need laborious and intensive monitoring. People with type 2 diabetes who are on multiple doses of insulin are not getting controlled on oral medications. Pregnant women with diabetes, they need 4 to 5 times monitoring every day. People at high risk of low sugar or hypoglycemia, like children or elderly people. People with erratic eating habits, they're very busy, they don't take care of meals, and when they eat, they're eating wrong type of food, so they can adjust the quantity and type of food. And frequent travelers, there are some people who need to travel frequently, and their discipline goes haywire during traveling. So those people, it is very, very good for them. Now, currently, there are 3 different types of CGM. One is obsolete now, which was just for the physician and which we used to use earlier. But the most commonly used ones are Freestyle Libre, 1, 2, and 3, but at present we have only 2. 1 is going off the market, 2 is better, and 3 is going to be much better than 2. Dexcom 6 at present is available. You can see the picture here. This is Dexcom 6. Oops, sorry, what happened? Okay, so this is Dexcom 6 and this is Freestyle Libre. So most of you have used Freestyle Libre 1 or 2. Now in Dexcom 6, the glucose is monitored and every 5 minutes you get the reading on your mobile. While in Freestyle Libre 2, you have to scan to get the reading. But they have updated the software and they are saying that now every 1 minute the reading will be displayed on your phone. So Dexcom 6 and 7, if we see it's available, 6 is available in UAE. You can see the whole kit here. This is the applicator with sensor, and on the sensor we fix the transmitter which transmits the glucose levels on your mobile phone. There's no scan required, it checks automatically, and every 5 minutes you can see the reading and you can see the trend. It's approved for people aged more than 2 years. It is water resistant. So if you are a scuba diving lover, you can still use it. But don't go more than 8 feet. So if you're a trainer, it's fine. So 24 hours it can be underwater. It has low and high sugar alarms. It has predictability of low and high sugar. It will predict and it will suggest you that now in 10 minutes, 20 minutes, 30 minutes, your sugar is going towards low. Or it will predict that it is going towards high. One sensor is being used for 10 days. So you get the kit of 3 sensors. And most important thing with these devices that the mobile phone compatibility should be checked before you put them. Sometimes some mobile phones, they do not have the software, support for the software. Then this sensor is compatible with most of the insulin pumps also. And these are the sides you can use in arm or stomach or the back if you're a younger person, and yeah, the stomach. So this is the way it shows the trend. So you can see here, if the sugar is maintaining at a level, it will show this sign. If it's rising, it will show like this. Again, more rapidly rising, it's very fast rising, it will show you up and the 2 arrows here. Falling, it will suggest you that it's falling, and then rapidly falling will be down, 2 arrows. So this will tell you to take the action if the sugar is going low or high. The good thing is that when you put this sensor, your doctor can be connected with you. The person who puts you, he will take your doctor also in the loop. So what you are monitoring, it will directly go through the cloud to the doctor's desk. And you can interact with the doctor can help you in telling you that something is going wrong here and you need to take action. The second, which is the most commonly used because it is more cost effective, is the Freestyle Libre 2. So here, in the earlier version, earlier software required that you should scan, then you will get the value. But recently I came to know that the software has been updated and you don't need to scan it, it will automatically. But if you are not scanning for a long period of time, then there's disconnection, you have to scan again to start. This is also for age more than 2 years. Then you can see here that water resistant, but swimming allowed only up to 30 minutes of water resistance is there. And it's only 1 meter. Low and high sugar alarms are there, but the predictability is not there. But you'll have to check whether sugar is going or low. So if the sugar is low, it will ring the alarm. It is high, what levels you set for the alarm, that will ring accordingly. One sensor can be used for 14 days, and at least 7 to 10 times if you are scanning it, don't have the updated software, at least try to scan all the before and after meals so that you can know what is happening. Again, the device compatibility must be checked, and it is cost effective, so it is more popular. In this also you have option, and good thing is that when you are wearing the sensor, your many family members can be notified. They can be involved in that cloud system. And your family member will also come to know what is going on with your sugar levels. So if you want to, if you are an elderly person, you can assign one family member who can also track your sugars if he or she is out from the home. So for the caregiver also, it is very, very good. And again, this can also be connected with your doctor's desk, and doctor can monitor what is going on with you. Now, very important thing, how to analyze the data in this. Because when you're using the sensor, but if you don't know all the tools which you have to use, then it will not give you the full benefit. So there's some important things to remember. It gives you rough idea of estimated HbA1c, which you will see. Look for TIR. That's the most important thing. The time in range, the range which you have decided, like 7 to 8 is the most commonly used range. That how much percentage of time your sugar is within range. That is the most important thing. And I'll discuss that, what are the targets. Then you see the glucose profile. It will show the curve. And you make sure that you don't go too far, too much away from the median line, which I'll show you. Then daily log, the daily readings which you are doing, it will tell you that what changes you have to make for the food and what should you do to make it better. And in Dexcom G6 we have predictability for low and high sugar. So these are the TIR ranges for different people. So if you see here, type 1 and type 2 diabetes patient, most of them, their TIR, the green bar, you can see that on the left side in the menu, in the sensor, when you are using it on your app, more than 70% time, your level should be in green. That means you are within range. Then if suppose older person is there and high risk person, then more than 50% times. Pregnancy with type 1 diabetes more than 70%, but with pregnancy type 2 and gestational diabetes, the TIR should be more than 90%. And if you see here, this is the graph. You can see that you should not have too much of up and down in this, and the variation should be less than 36-37%. So if you are going like this, that means there's too much of variation, and which is not good for your health. So here is the correlation between TIR and HbA1c. So you can see 70% TIR corresponds with HbA1c of 6.7. So this will help you. We use these two tools as complementary, not competitive. Remember, every 10% increase in TIR leads to 0.8% decrease in HbA1c. So there are different advantages or disadvantages for this. So it offers alert, it tells you the low sugar, high sugar, it transmits data continuously, it shares the data with the doctor and the family member, it eliminates finger pricks. But I always advise to keep checking in between with the glucometer, because there could be 20% error margin. We have seen sometimes the sensor is faulty also. So in the beginning, we should always check that it is corresponding. There is some difference of 20 to 20 with the glucometer, but always have cross-check in between that the sensor is not faulty. Then disadvantages are also there. So it requires setup. Some people who are not very savvy with the gadgets and all, they may have difficulty. Sometimes alerts can be tiresome. you are sitting in a meeting and it is giving alert sugar is more than 200, 250, so that you decide that what do you want to do with them. As is not covered in most of the insurances, the cost is a factor for some people. Up to 20% error margin. Accuracy is slightly less accurate than glucometer, but not much. And there is 15 minutes delay. As I told you, it's measuring the interstitial glucose, not the exactly blood glucose. So what level it is showing, there is a delay in comparison to exact readings. So what is the future of CGM? We are going to get smaller and more compact sensors. You can see here, this is Freestyle Libre 3, and here they have made it more simple and smaller. Then Dexcom 6 also, they will have only one. There will not be any receiver and sensor separately. At present they are separate, so it will be all in one. So Dexcom 7 and Freestyle Libre 3 will be more easier to use and much smaller, and technically they're easy. The technical part will also become easy. The last one is the EverSense implantable sensor, which I told you in the beginning that it can be implanted in the subcutaneous tissue for 6 months, and you can monitor your sugars for 6 months. So you don't need to do and change repeatedly. It is not yet available here, but it's available in US. It's not compatible with the pumps. Now most of the sensors are not MRI compatible, so if somebody is going for MRI sensors, they should be removed. So with that, I would like to summarize that continuous glucose monitoring, or CGM, is not just a technology, but a lifeline for individuals with diabetes. It is the promise of better control and greater freedom, and a world where managing diabetes is simpler and more effective than ever before. CGM is a beacon of hope, proving that technology can indeed change lives for the better. Thank you very much.